But if you really want to make a difference, get out there and educate. But educate in a way that creates awareness that you just don't know enough to be doing this in most cases. And if you do that, if all of us do that, now you're putting the horse back in the barn. If you want to protect our turf and get more of these cases in the ortho office, get out there now. Hello there, everybody, and welcome to another episode of your 5-Minute Friday. I'm your host, Dr. Glenn Krieger. In Orthopreneurs recently, there was a post by a doctor who was talking about a webinar for a company that, and I don't want to mention the name. I don't want to give them any publicity right here and right now. If you're in Orthopreneurs, you know exactly what I'm talking about. It's a company, one of probably 4 that I know of right now, that is going to work through GPs, having orthodontists approve clean checks, and through some financial arrangement that's considered legal, the orthodontist sets the case up and the GP delivers the care. If you haven't heard of it, they exist. There's many of them. But ultimately, it was crystal clear that orthodontists want nothing to do with it, understandably. I was always in favor of getting more information and learning about it, right? Wouldn't it be great to actually know the details of what's going on there? But something then went on that really bothered me a great deal. And I'm going to talk about it here. The owner of the company went out, or the founder, went out and posted screenshots from Orthopreneurs on their, I'm not going to say the male or female, on their particular Instagram account, showing how orthodontists are against this idea and that we're totally different than some at-home aligner company that you all know about that is really not a player anymore. And it really bothered me. And I know it bothered me, and I know it bothered a lot of you who messaged me directly. And, you know, I'd like to bring this up as a topic that we're not going to see go away. This is just one of a number of companies that are looking to leverage orthodontic knowledge to develop a dental model. So the dentist is going to do ortho, and the orthodontist is going to set it up, and everything works out that way. Now, again, I would say, based upon the reaction, it was pretty clear that most orthodontists don't agree with this model. But in the process of the discussion, one of the things I pointed out is that I meet with my general dentists and teach them how to look at Invisalign. Now, there are cases that we can all agree a general dentist could probably take care of without too much muss and too much fuss. But there are some simple cases that look really, really easy that turn out to be nightmares. What are some examples? I would say when you see lower crowding and upper spacing, well, minimal overbite and no overjet, that's a nightmare waiting to happen. Class 1 molar and cuspid locked in already. It's a Bolton discrepancy of significant proportion. When you see lower crowding, assuming the roots are in proper position and proclinations are in decent position, when you see crowded lower anteriors, even if it's 3 millimeters of crowding, 2 millimeters of crowding, and a little bit of spacing in the upper, those are the cases that have caused me the greatest trouble over the years, especially in a deeper bite, right? When it's a little bit of a deeper class 1 bite, those are tough. And I've gotten so many of those from my general dentists who started them and 2.5 years later still aren't finished. But there are cases that are very easy to treat. And so what I do is I present to my referring doctors, here are the cases you can chase, and here are the ones I would stay as far away from. But during the course of doing it, I explain to them some basic isms that we learn in ortho residency from a mile away. Simple things, like a class 2 div 2 with an extremely low angle is going to be a bear to treat. But it's at this time when most of my referring doctors look at me and go, I don't know what you're talking about. I have no clue what do you mean a low angled class 2 div 2 is tough to treat? And the more I explain this stuff to them, the more I create an awareness that they don't really understand what they're doing. They're doing it because they took a weekend course and they're trying the best they can for their patients within the paradigm of where they're working. So you can look at GPs doing ortho in one of 2 ways. You can look at it as either they are maliciously disregarding their patient's best care and not referring to orthodontists and just trying to make money, and I don't care what the outcome is, I'm going to do it anyway. And I'm sure there's a fair number of those out there. But the overwhelming majority of people I work with who are doing Invisalign, I think what they're saying is, I went to this course, they showed me how to do it. I may not be an orthodontist, but I can do them pretty well. And so I'm just going to start getting started with the cases, and if worse comes to worse, I'll refer it to my orthodontist. And they don't realize they're digging themselves a hole in most of the cases that'll never get to where they need to be. To them, good enough is good enough. As long as the patient isn't damaged, everything's fine. But I think it's incumbent upon us, and this discussion brings up the idea that I think it's incumbent upon us to educate our referring doctors, to teach them to understand hey, wait a minute, guys and gals, let's talk some terms that you've never even heard of. You don't even know what I'm talking about. So that maybe, just maybe, you take a step back and go, maybe this isn't a good idea. And I've seen that many, many, many times. And so in these Facebook groups, orthodontists love complaining about things like what this founder posted. They love complaining about it. Oh, this is terrible. Oh, this is awful. Oh, blah, 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 blah. You know, we should, and raise their hands in pitchfork fashion of what we should do. But they don't do anything, right? Let's just sit around in a circle and complain the whole time. Well, at the end of the day, you can do something. You can educate your GPs so that the ones who aren't the money grabbers, the ones who honestly think that they can do it reasonably well, recognize how little they know. And sure, like me, they can go back to school and become orthodontists, or like me, when I was a GP, start referring all of your ortho back to your orthodontist. If you're listening to this and you're pissed off about at-home aligners, you're pissed off about the idea of orthodontists helping GPs do cases, then get off your butt and start educating your GPs so that they understand, explaining things like dolichofacial, brachyfacial, not explaining what it means, but when you say to somebody, yeah, this is gonna be a really hard case, brachyfacial, low angle, this is gonna be a nightmare to treat. It's a big, complex topic. I'm not gonna get into it now, but if you're doing ortho, you should know this. Put a little fire under their butts. Get them a little scared to understand there are ramifications for not treating properly. There are ramifications when you don't understand how to diagnose a case properly. And I've been doing that for the last 3-4 years. My relationship with my referral dentist has never gotten better. They do treat some cases, but they treat the ones that are very easy for them to treat. They're kind of very limited cases. But when they get a tougher case, a class 2, even a deep class 1, whatever it might be, it comes my way. And some will never refer because they're money grabbers. And all the education on the planet will never make a difference. And they probably won't even do these programs that I described to you earlier with the ortho and the GP, because it means they'll have to lose some of the money that they would ordinarily be taking. But if you really want to make a difference, get out there and educate. But educate in a way that creates awareness that you just don't know enough to be doing this in most cases. And if you do that, if all of us do that, now you're putting the horse back in the barn. Now you're helping make sure that our profession, I'm not going to save the profession because I think it's a BS concept. Nobody on earth talks about their profession as having to be spared except for orthodontists. But I will say, if you want to protect our turf and get more of these cases in the ortho office, get out there now. Don't sit around and complain in Facebook groups. Create a presentation that shows your orthodontists cases that they can tackle and cases they shouldn't tackle, and make sure that you're not getting into long discussions about biomechanics and what have you, but explaining in very basic terms, here are the things that are going to snake bite you, and if you want to feel that way, you want to have a patient in treatment for 2.5 years for a case I could have treated in 6 months, then go for it. But here's the reason you shouldn't touch this. And the next time you see this, just send it to me. The next time you see this, you can tackle this. Because a class 1 molar and cuspid with ever so slight crowding in the anterior, where there's maybe 2 millimeters of crowding, go chase it. But you better know how to handle attachments, especially on upper lateral incisors, right? And if you say it like that, and say, and of course upper lateral incisors are going to be a nightmare, you better know how to handle that. What do you mean, Dr. Krieger? How do we handle it? I'm not getting into that now. It's too long of a topic to explain. You should know how to do that. If you don't know how to tackle them, maybe this case shouldn't be treated by you because you're never going to get it solved. And anybody who's ever done ortho through Invisalign or any sort of aligner knows upper laterals are a freaking nightmare to track. So these are the things you can explain, and I hope it makes some sense. I hope to see you at Summit, opsummit2025.com. Much love to each and every one of you, and wishing you a great day.